And it just turned 2 o'clock, so it's a great time to get started. Thank you so much for joining us. My name is Sara, and I'm a staff member at the Arizona Statewide Independent Living Council. And I'm pleased to be working with the Arizona Department of Public Health on these webinar series that will go on all summer. And they're specifically focused on disability justice during crisis, and this webinar on racial justice during COVID-19. And I want to hand it over right away to our first guest speaker, and that is Jordann Lankford Foster, and she is an immersion teacher at Great Falls Public School and one of the finalists for the 2020 Best Teacher of Montana Award, which is really cool. So I'm going to hand it over to her. Thank you.
Hi. I hope everyone can hear me well. My name is Jordann Lankford Forster. I am an enrolled member of a tribe here in Montana. I'm reporting to you from Montana. I am Anishinaabe and Aani. My Aani name is Bright Trail Woman. Miigwech, thank you so much for having me. I guess I am opening it up and just getting the conversation started. First of all, I want to thank, the state of Arizona so much for having me. I would like to take some time to acknowledge the inherent tribal lands, whom everyone is on right now, especially here in Montana. I'm really excited to be with you guys today and just kind of get the conversation going. So I guess to start out with, the work that I do here in Montana, I'm a dropout prevention specialist. So I run a dropout prevention program for our American Indian students here in Montana. And I also am an instructional coach for educators. So I instructionally coach them on how to incorporate Indian education for all in their classrooms. I'm really proud to be a part of this conversation today because it is important. Why are we talking about racial equity in this conversation that is combined with medical practitioners and response teams and things like that? And why are we having this conversation about equity? And long story short, this conversation around healthcare and equity, it is specific to and is contingent on a racial conversation because we need to look at the communities that these issues affect. And right now, what we're seeing in our country is this overwhelming disparity between people of color and what's happening with COVID in conjunction with what's happening with our racial injustices. So I know that these things don't sound like they relate, but they really do. And this is how I will explain it. The best way that I can explain it is I went to a training probably 10 years ago, and this guy was talking to us about education and equity in the classroom, and how he explained it. It was so perfect. He said, if folks, you get 2 different patients in the emergency room, and one of them is a pregnant woman whom is giving birth, and another patient reports to the emergency room and they have a headache. And if you wanted to be fair, you would give both of them a Tylenol. And now, I've never been blessed enough to give birth before, but I've heard it might take more than a Tylenol to get you through that. So long story short, fair is different than equal. If we want equal, if we want equity, you need to meet people where they're at. So to be fair, you would give the person with the headache and the person giving birth a Tylenol, but that's not what they need. And I'm assuming what this conversation is about is meeting people where they need to be met. And so I'm very happy to be a part of this. I know that you guys are going to hear from a panel today that is going to focus on a couple of questions, but I just wanted to talk about where I come from and my perspective on it. And I know that you guys are going to be hearing about experts that are probably far more versed and articulate than myself. But again, thank you for having me. I just kind of wanted to start it off and give me a little grace. I'm reading off of some of my notes. I prepared a little bit. Why COVID doesn't discriminate, but it does target people of color differently, and it does so, and that's why we're having this conversation, is because the depth and breadth of that is more so. And I think this conversation is going to extend upon far beyond race, because what we're seeing is it's not a disparity, and people aren't at a disadvantage because they're of a different race. That's not the problem, but it's a larger scale of a socioeconomic disparity in our country. And I can only speak from an American Indian perspective, but I would encourage those who are on the call who are not maybe so familiar with federal Indian policy specifically, and federal policy throughout the country historically has left people of color at a disadvantage. And so now we can't be so surprised that it's affecting these people at a disproportionate rate, at a higher rate, when they haven't been given the same opportunities as everybody else to succeed, if that makes sense. Also too, I'm not sure who's moderating this, but if anyone, I'm only speaking for a little bit, but if anyone has questions or concerns or anything, maybe if those could be relayed to me at the end, and maybe I could make some time to answer those, but I don't want to take up too much of the panel's time. I want to be respectful of your time. Something that is going to be addressed today as far as what are the challenges, addressing the racial health disparities. Just from my perspective, I would say transportation. I live in an urban population, which when in terms of American Indian people, urban means off reservation in Montana. And I know that so many of our American Indian people rely on public transportation. And then you have the whole disparity of off the reservation. They're in these secluded small towns, which makes it very difficult for them to even be seen. But something that I've experienced very much with my students and our families is their inability to pay. And so when you have this inability to pay for your needs, there's a barrier, there's a discrepancy. You're not willing to even go in and get checked out, if that makes sense, because there's an inherent shame. You feel embarrassed because you feel like you're not even good enough to be in the doctor's office, because in your heart you're not going to be able to pay what middle class folks might be able to do so. So there's that disparity. Also, overall in our country, what I'm seeing is there's an attack on the welfare state. And I don't want to say that I'm in total support of a welfare state. I believe that people should be contributing members of their society. But, when you're experiencing these inequities that aren't addressed, people, again, back to the hospital analogy, people need to be met where they're at. And so just because everybody isn't at the finish line doesn't mean that they don't deserve equal care. And, people who are against this welfare state or helping out other people, when I coach them and when I train them, really what they don't like is they don't like this idea of other people getting something special or special treatment. And, it's funny to me, funny, not funny, these are the same guys I get into these arguments, people who are against free money or special treatment or something. When I talk to them and I coach them through it, these are the same guys that play the lottery every week. And so for them to say that they're against a certain group of folks getting this free money or this special treatment, it's so funny to me, because no one would say no if they were in that situation themselves. And so it's funny, not funny. It is what it is, but it's just part of a longer, bigger conversation of a socioeconomic disparity that affects our people of color. And that's why COVID is hitting so hard in these areas. I think that historically, with the government, there has been, with people of color, a historical perspective of mistrust, because for so long, even through today, the government has always been in charge of people of color and telling them what they should and shouldn't do. And there's not a level playing field right now with the government or its agencies. It's always them telling people of color what's best for them. And, you know, when you are, I don't want to say a victim mentality, but when you have so long answered to an oppressor, it's really, really hard to ask the oppressor for help when you need it. As a country, we watched the murder of this man. We watched it together. Some people have watched it over and over and over again. And what I'm praying for, what I'm hoping for, is people don't forget about that. People don't just jump on the bandwagon for 2 or 3 weeks and say Black Lives Matter or people of color's lives matter. I hope that this is a broader conversation of really the mistreatment and the mismanagement of people of color. And even the fact that I have to say that people of color have to be managed is so disheartening. Especially, I think it's like poetic that this conversation is happening over the 4th of July weekend, because we're the land of the free because of the brave. And I think it's poetic that we're having a conversation of the depth and breadth of people and how really free they are, because a lot of people have no idea of the injustices of people of color and the inequity of people whom experience disabilities in their lifetime. They just don't understand that schema. What's really important to me through this conversation that I know that you guys will have, and I know that it's going to be farther reaching than just today, just this time, is I want us to get away from a reactionary society. So when we talk about, you know, police reform or medical reform, it's all done in a reactionary sense because we've experienced this pandemic and we've experienced this visual racial inequity. I hope that what comes from this is a longer conversation and not just something that happens to the folks in the medical field or the educational field. What I would really encourage is, I do think that people need training. I do believe that there needs to be a sense of reform. But what I really would advocate for is the type of training that just isn't done to you because, you know, people, they're in the medical field or they're in the police or first responders field, and they think that like this training as far as an intervention is just another thing that's going to happen to them. But what I would really advocate for is whatever training comes out of this is that it's also self-reflection and time for people to look within themselves and examine the bias that they really have. Because if it's just another training where something's done to you, there's no change in the heart, if that makes sense. I hope that this creates a wider conversation of how do we examine our self-bias to change our hearts, because that's where the real change happens. That's where people really re-examine their schema of things. And that's where the real shifts occur, instead of just, oh, we had to go to, a feelings training or something like that. We had to go to a sensitivity training. I hope that the training that comes out of this incorporates a real self-examination of the person, because then they're able to be reflective enough to understand how to respond differently to situations like this. They're able to understand where they're at, so their needs are met, so they understand how they relate to other humans in this world. I'm in a very unique situation where my stepdad, he's non-native, but he's actually a captain in the sheriff's office, in our local sheriff's office. And he, you know, I could say we've had very colorful conversations along the way. But everybody, as humans, we want a sense of understanding and a sense of knowing. And so, you know, he has never lived in a Native world or understood a Native perspective, but he's had this schema of who American Indian people are in his brain. And then as humans, we look for that schema to be verified, to like become true. So every time he responded to a call as a deputy, his belief system of American Indians or people of color was always verified to be true, because that's who he was responding to, that's who needed help, that's who was in crisis. And until we developed this relationship and he was able to understand another perspective and another side of that, you know, that's where his growth, and I'm not saying this like I'm the all-knowing, I'm still growing, I'm still on the spectrum, I'm still on the schema of learning and understanding people's perspective, but that's where his heart and his understanding really began to change. And so my hope for everybody participating and my prayer is that it just doesn't stop here. It continues. And whatever comes out of this, we're really able to look at ourselves and explore our own biases, because that's where the real change is going to occur. It can't just be this superficial, well, we had to go to training this weekend to learn about these other people. It has to be, we can put ourselves in those situations, whether it be people of color, LGBTQ folks, people with disabilities. It's really a humanitarian aspect, and that's what elicits change. And so I just want to say to you all, I don't know you, but I love you. And I know that sounds weird, but I don't know you, but I love you for participating in this work and being involved and being dedicated to this illicit type of change that really, it really is uplifting. And so I respect all of you, and I really respect you for joining us on this holiday weekend. I hope that you all have safe travels if you're going somewhere, and I hope that you get to spend some time with your families and the people that you love. I don't know if there's any questions for me right now, but I thank you all for having me.
Thank you so much, Jordann. And I do see that people have asked for your contact info in the chat, so I'm going to go ahead and put your email address in there, if that's okay?
Sure. Yeah,
Awesome.
Do you have it already?
Yep, I'll pull it
Perfect.
up right now. And
Great.
thank you so much for being here. And
oh my goodness.
Welcome to stay and be part of the conversation, but I know you're traveling, so if you need to take off at any time, go ahead.
Sure. Yeah, and if anyone has follow-up questions or a deeper dive conversation, I'm more than happy to do so. But again, thank you guys for having me. I'm honored. Miigwech, again, thank you in my people's language. And I really appreciate your work and dedication and passion to this work. That's excellent. It's great. Thank you all so much.
Thank you, Jordann.
So yes, enjoy your meeting.
And then I am going to pass it off to our someone I'm proud to work with at the Arizona Statewide Independent Living Council, and that is Grace. And not only did she particularly ask to volunteer above and beyond her internship work to be a part of this webinar and discussion, you know, she is the one who wrote the summary and helped develop the questions with me. And so I'm really excited to hear the themes that she had learned and wanted to include in the questions today. So I want to give it to Grace, and then at 2:30 we officially start with the panelists. Thank you.
All right, thank you. So I'm going to first talk about like a personal story within my family that deals with racial inequity, and it kind of explains partly why some minorities feel uncomfortable seeking out medical care. So my great aunt, she had a history of ovarian cancer, and she had to get a hysterectomy. And during
I hate to interrupt, but I'm having a weird echo on your end. I don't know if you want to move your mic around or see, because we don't normally have it.
Oh, is this better, or is there still an echo?
It's still a little strange, yeah. But go ahead and give it a try. We'll see what we can work with. But I wanted to let you know that that was happening. I can still hear you, but it's just a little background noise.
Okay, sorry. So my aunt, because of the procedure she had to go through and everything, she had she had to go through a lot of doctor's visits and procedures like that. So throughout that time, she never liked going to the doctor. She felt very uncomfortable because the relationship between her and her doctor was strained due to she never fully understood what the doctor was trying to tell her about the procedures, about her health, and where she was at with her status of health. And she felt that the doctor was always getting annoyed and becoming short with her because of how many questions she had to ask to fully understand. So a lot of times she wasn't wanting to go to the doctor. Sometimes she skipped some visits, and because of the ovarian cancer she had, it was very critical for her to go to the doctor regularly, and it was just not a good experience for her. And she, to this day, she still doesn't like going to the doctor. So I'm gonna get into talking more about racial justice within the health system. So I thought it was really interesting as I researched some of this stuff, such as white women are slightly more likely to develop breast cancer than Black women, yet are less likely to die from it. And I thought this was just a perfect example of how minorities are unfairly affected by chronic illnesses and health issues more than their white counterparts. Because in a 22-year time period, breast cancer death rates for Black women decreased by 23%, and then death rates for white women declined by 42%, which was significantly more than Black women. And it's clear, through research, that biology alone couldn't explain away the large health disparities, and it has a lot to do with access to and quality of care. And there's a lot of intersectionality that plays with it, socioeconomic factors, and just a lot of institutionalized and systemic racism. And someone's race shouldn't be a determinant of whether they live, yet compared with white members of society of the US, racial and ethnic minorities are less likely to receive preventative health services and often receive lower quality care. And preventative health services help a lot with determining if you'll survive a lot of chronic illnesses such as cancer. And they also have worse health outcomes for certain conditions. So finding ways to identify the structural racism and implicit biases in health systems can help achieve health equity with minorities. And during these times, I think it's bringing a lot of attention to health disparities that many people and many minorities already knew existed, but some people who don't experience quite as large as health disparities, they're starting to recognize that they exist, especially since in the US, minorities are being disproportionately affected by COVID-19. The death rates and complications are higher than they should be, based on how certain minorities represent the population of the US. I'm sure everyone knows by now that the Navajo Nation has one of the highest coronavirus death rates in America. and it's the highest per capita when you take into consideration their population. So like the density of their population for their size. And Black people are more than 3.5 times more likely to die from COVID-19 than white people, and Latinx people are nearly twice as likely to die of the virus. So despite the health disparities during this pandemic, almost half the states don't track the race and ethnicity of those who have died in the pandemic. And the states that are tracking racial and ethnic data don't account for the age differences among population groups. And it's really clear that it just affects not taking into account the ages of the ethnic groups that are dying from COVID-19. It really affects the data to see like the full effect of the health disparities with the pandemic, because as you know, age affects how you're affected by contracting COVID. Older age groups and younger age groups are more likely to experience COVID more than people who have better immune systems. So it's making it really difficult to accurately compare the risk of COVID-related deaths across the racial and ethnic groups. And I think it's important to really examine and fix the health disparity issues before they deepen, because there's a real risk of health disparities deepening with as the pandemic has like a large likelihood of going into 2021. So yeah, thank you for listening to like why I think this conversation is important. So.
Thank you so much, Grace. I really appreciate it. And we lost one of our panelists, but I am going to just give them a call, and I'm going to turn it over to our first question. So before we get into our first question, let me introduce Dr. Diane Hernandez. And sorry, taking notes. The assistant professor at Columbia Mailman School of Public Health, and I'm excited today to get her opinion and insight about racial justice during COVID-19. And I'm going to have Grace go ahead and get started with the first couple of questions as I make sure we get our other panelists in.
Okay, so the first question we have is, why is a conversation about racial justice and racism needed in public health and emergency management?
So public health is really about, fundamentally, it's about kind of taking preventive measures, primary preventive measures, secondary preventive measures, tertiary, meaning that we want to like stop disease to begin with. In the COVID context, it's that people don't ever contract the infection. We want kind of the secondary prevention, which is that people don't spread it to others, and kind of likewise on the tertiary, it's really about kind of addressing some of the fundamental risk factors for individuals, and the importance of race and racism in the context of COVID really is about documenting who's impacted and to what degree the impact is disparate based on a number of factors. When COVID was kind of first introduced to the world, we imagined that it had to do with age, and that age was the primary vulnerability. And one of the interesting things about kind of health from a global perspective is that in many other places they have, developed countries have not only more kind of comprehensive health services that are often free, But per capita, what we spend in the U.S. on healthcare, kind of is really, we don't get a high value for the dollars spent, meaning that we have an unhealthier kind of population, and we spend a lot more in terms of healthcare dollars. So from a global perspective, age would, kind of make sense because you have a healthier population to begin with, and it's really vulnerability in older age that would determine who's more affected by COVID. So, the initial guidance was ensure that older folks, for instance, have protections. But then the COVID color line appeared and so many other aspects of health and well-being and life chances and socioeconomic status are so closely tied with race, and health disparities have, kind of long existed, and we recognize that that different racial and ethnic groups have very different health profiles. And it was important to be able to document the differences by race, by ethnicity, by place as well, and by occupational status, because it gives us kind of a better profile of the various ways in which different groups were more likely to be infected, more likely to suffer from more severe illness, and then also die at disproportionate rates. And unfortunately, in the United States, that meant that African Americans were twice as likely to die of COVID. And other minority groups were also, like people of color, Latinx, African Americans, other groups that are kind of more doing, kind of essential work just on the basis of labor market segmentation, has made it so that, they are also disproportionately impacted in comparison to more privileged groups, such as kind of higher income groups and whites in the United States. So essentially the purpose for understanding race and racism is to appreciate, who are the kind of vulnerable groups, why are they vulnerable to COVID, and what can we do to prevent, kind of primarily and secondarily, but also, what do we have to do to try and now reduce risk for, as we kind of enter into a whole new phase of the pandemic, and it looks like kind of more cases are coming on board that they might be determined by something other than race, occupational status, and place.
Okay, so that's great. I think you started to answer part of question 2, so I'm gonna go ahead and read that. COVID-19 doesn't target people of color. So could you explain to our audience why our COVID-19 rates are higher in minority communities?
Am I the only one answering? At the moment, we just have one other person that's having some technical difficulties that should be popping back on, but that's why we're just doing a couple with you.
Got it. So there are a number of factors. One that I kind of talked about in an op-ed piece earlier on, in the as the pandemic was kind of coming, was just emerging essentially, is that social distancing is a privilege. Those of us that are able to work from home, that don't rely on public transportation, that work in professional settings that allow us, to still have an income and, do our work safely from home, are in a very different position than frontline workers, and not just frontline healthcare workers, but also the delivery people, the folks that are working in grocery stores, civil service, workers, so many different kind of profiles of folks that are unable to do their work remotely and via kind of technology, in part because of the kind of how labor market discrimination works, where people are segmented based on race, where they're segmented based on kind of who they are. I think the other piece is overcrowded housing. So there are, I'm based in New York City. New York City is a vertical city. Many people live in apartment buildings, and that is shared space. The common areas are shared. The buttons on the elevator are pressed by a number of people. And I realize that that's a little different than the Arizona context. But one of the, we in New York City, like, kind of went through the whole thing. Part of it is the urban density. And like I said, the kind of crowding that is in some ways based in the fact that, as an affordability strategy, you have folks that are doubled and tripled up in their homes as a way of kind of managing the rent. And again, that has a lot to do with what people are able to earn in their jobs. So, it's the ironic, but the people that are the frontline essential workers earn the least amount, have to resort to like the kind of crowded housing strategies in order to, to make it. And then the other piece of it is a reliance on public transit or on congregate settings, otherwise like kind of more public and congregate settings. And again, here I'm speaking from a New York City context, but I think that has a lot to do with, it's much harder to isolate if you are relying on the public transit system, so that I think, all of that has something to do with it. There are ways in which socioeconomic status and financial privilege has allowed many people, including myself, and I think it's also important to kind of acknowledge our own privilege when we have it, and not necessarily make this about like us and them, but there have been many ways in which financial security has made it so that my own risks are reduced and the risks of other people like me are also reduced. But I could also see, I live in the South Bronx, which happens to be one of the poorest congressional districts in the United States. And so many of my neighbors haven't had the same opportunities to just stay home. They haven't had the same opportunities to like not get on the bus or train. And they don't have the same opportunities to not share a bedroom or living quarters with other people. There was a study that was done where they found that most of the people that were contracting COVID at some point were doing so even though they were home. But it's because they were living with others who were engaging with the outside world. So as individuals, they were doing what they could to reduce their risk, but they couldn't manage their risks completely because it was also about who else was kind of engaging with the outside world. So yeah, that's my answer. Some of it has to do with social distancing. Some of it has to do with healthcare and access to coverage and testing, and how, kind of that is determined in so many ways by where people live and by their insurance type. And that has not been, like an easy situation to rectify. So you have inundated hospitals in some communities because sometimes emergency care is the care of first resort, not last resort, even for the most mundane of health issues. And those are the same hospitals that are like really feeling the pressure now with managing COVID, because the populations that they serve are sicker, they're more at risk, and the hospital systems are, much more kind of stressed and burdened. in terms of managing all of those elements. So it's a number of different factors, but those are just a few.
And thank you so much. Our other panelists have technical difficulties that won't be able to be resolved, so won't be joining us. So let's be a little more informal. I know that you have a time limit, so make sure is that at our time's a little different. So 3:30, our time is 6:30 your time. Okay,
right.
Good. So all three of us know the question, so I thought maybe we can just get through the subject without having to be so formal to them. Something I was really curious, from you working in this field of public health. Recently after the George Floyd murders, there was a lot of protests, and public health officials were on TV, I thought giving very measured responses about how it would spread, but, it's also important to act, take civil action to make sure your rights are represented. And, but they also got a lot of backlash for that. And I was curious, what do you think, is there a right answer? Is there a way they should have handled that?
Well, I mean, it's kind of like what I tell my mom. So my mom is an older person, and, she's kind of had to reckon with her own vulnerability more recently. And what what I tell her is, Mom, you know how to be safe, right? You have to wear a face, cover and wash your hand and all that stuff. And so, and I actually think that that's a very promising way of thinking about how to move forward, not just in terms of engaging in, civil action and demonstrations for social justice, and all of those things are really important. And I think we should encourage people to engage in that way, especially now when there's not much more to do, but we also see, and we can't unsee the realities of racism and their kind of intractable impact. And so I think we do this is the time to act, because we can no longer deny that, there's this kind of unequal reality in the United States. At the same time, we know how to keep safe, right? And I think that that's one of the reasons why, in New York City, for instance, we haven't seen, the numbers really increase as a result of the demonstrations, because people have really been complying with the masks and, the kind of other safety measures that, have all, come out and have evolved over time. In terms of our understanding, but I think, we can't rest on our laurels and say things are fine, the weather is nice, and we should go out. I think that maintaining safety is important. This doesn't seem like it's going to go away, so we do have to recognize that. But at the same time, we're not without options, and we're not without the opportunities to stay safe.
Thank you. And, another question that just leads into my own family. They were very upset with public officials for giving conflicting information about masks and how we should prepare during that time period between January, mid-March, where things are still questionable. And, just from that made them distrust further information. And I couldn't imagine what it would be like to be part of a minority group that has had a genuine reason to mistrust the government for a significant period of time, and how that might affect generations later on. And I was just wondering, we haven't in one of the questions, but how does mistrust of the government play from just historic racism?
Well, we're seeing this play out in a lot of different ways, right? Mistrust around public health information, but also mistrust around police, right? Fundamentally, when there is this kind of protest, it has to do with the fact that police are the face of the government, and they are in some ways a more tangible, a representation of government, and people are kind of acting out at a moment where there hasn't been a lot of opportunities to trust the government. I think part of it is the frustration around just the lack of information about what to do. And to be fair, this has been an evolving process, and we didn't really know, the circumstances. And I think we were really caught off guard as a nation, period. And that has, like obviously the local components and the state level components, leadership matters a lot. And, we live in a very have bifurcated nation now. We have, it's like very different world views, and they haven't necessarily worked to try to come together. And so that is also really kind of demonstrated that, masks are now, it's not just the misinformation, but it's also how politicized mask wearing has become. And it's like, if you're politically leaning on one end or the other, then you comply or you don't. And that's really kind of a disservice. I mean, public health is really rooted in being apolitical, right? It's really about, the charge of taking care of the public's health. And that's what we want to do, and that's what we need to do. But we now have a better handle on the information. And I think we can no longer deny and negate the evidence. The evidence took time to emerge out of this, but at this point, we do know that face coverings are effective in reducing the spread, and we also know that there are other measures to be taken, and so that should no longer, regardless of whether or not people kind of trust the public health establishment, to some extent, the evidence is clear. But obviously we also live in a country where people make decisions for themselves and have the freedom to do so. But that will come at a cost if we don't, kind of take care of each other. It's not just that, the public health infrastructure is in place. It's also that the social infrastructure for taking care of ourselves and taking care of each other is also kind of intact.
And, from that, our first speaker was mentioning about, if we do have trainings, how they have to be done in a certain way to actually be long-term and sustainable for that individual. And I was just wondering, is there any interventions that you think would benefit people, that maybe are entering the healthcare profession or entering the law enforcement profession, that just might not have had life experience that is outside of, a limited version of their own?
Well, yeah, I mean, I think implicit bias training, right? I mean, there's a certain kind of recognition that we're all somehow biased, and that, this is not just like one group or another, but that we all carry stereotypes, and, we kind of lean on them to as sources of information, and, just recognizing that, and through implicit bias training is an important component to this. I wish that there were a time where our realities weren't so separate, right? Like if you're a person of color in the United States, it's almost understood that your reality and your trajectory is like one way. And if you're a white person in the United States, it's almost understood or expected that your reality is something else. And I think we just don't coexist in ways that would allow us to understand each other. Our schools are really deeply segregated. Our neighborhoods are deeply segregated. Like we just have very few opportunities to interact. And so much of that is rooted in these legacy racist policies from redlining on down that have really entrenched that separation. And yet it's really come at the cost of us being able to better understand each other and be able to kind of move past whatever initial impressions or stereotypes that we rely on to make sense of people. And I think that has been most detrimental to people of color, to men of color, to African-American men in their interactions with police, for instance, but in other ways too. So I want to, also make a case for not just the right now. Certainly the, recognition is the first step to justice, and we have to work on ourselves, even as we have intentions of making the world a better place. But I think also, we have to kind of look long-term and big picture about all of the other ways that we have to kind of dismantle the realities of racism, that are, kind of deeply embedded in our institutions.
Before I throw it back to Grace, there's one question that I'm going to surprise you with, but I think you'll probably still have a great answer. But when I was researching impact for this webinar, something I had never considered came up, and that was that individuals of ethnic minorities, specifically they were talking about African Americans, have that identity, and that plays a larger role than the identity of disability. And so for me, a white female, that's one of my first identities, is I'm a disabled white female, if you think about my list. And I thought that was really interesting that, the first thing they think of is like to group and organize around one identity versus another. And, I just wanted to throw it out there in case you had any thoughts about how that might affect like the disability rights movement and how we should be organizing with different minority groups.
Yeah, I mean, I think, that's really interesting, and I hadn't necessarily thought about that. But, intersectionality, for instance, is a kind of a recognized framework, right? It's to say that, race and gender and socioeconomic status, and I think we could absolutely include disability status, it's that they converge. Not necessarily that you can almost disentangle one from the other, right? So for instance, as a woman of color, right, like I have to contend with that reality, because it's not just that I'm a woman, and it's not just that I'm a person of color, but that it's, and I have to think about my own like kind of socioeconomic status and how that has changed over my life course. But at the same time, I have proclivities around poverty because I know what it is to be poor, in my childhood. And it matters to me, and it hurts my heart that there are so many people that are challenged by poverty because of their because of their race or ethnicity, right? So the disability piece, I imagine, kind of falls into this, but I agree, like we don't pay enough attention to disability issues. And so, there are other identities that seem more important because sometimes they're also more visible. There are disabilities that are invisible, and not that they don't exist, but that they are just not necessarily like, just open and visible for other people to appreciate and to understand. And so that's not how people are judged necessarily and initially. But race has been a way in which people are understood very quickly, almost beyond that deeper layer of identity that might come with a disability status.
So you talked a bit about like how different people from different backgrounds have to like view and understand each other, even though they're segregated in multiple senses. So I was wondering what types of reform you think is necessary to decrease the number of health disparities that minorities experience.
I mean, I think that we have to really go upstream, like to the extent that we do little behavioral interventions and, allow people to, have a little bit of, not to diminish the importance of behavioral interventions, but it is to say that I would rather see a focus on the more upstream determinants of health, right? Where we live, where we work, how we work, if we work, what we earn, like how we're able to live, there are how we're able to learn, where we're able to learn, how we spend our recreational time, that we spend recreational time, right? Like so many of those pieces, right? I just actually sliced up the idea of living, and where you live is not just the place, it's how. And where you learn, it's not just the place, but how, right? Like, and we think so much about health as being healthcare related, but in fact, how, health is about the decisions that are made easy for us because we have access to produce, the decisions that are made easy for us because we don't have to breathe polluted air, the decisions that are made easy for us because we live in healthy housing that we can afford and stay in stably over a period of time. Health is also decided by the neighborhood conditions, how safe they are, whether or not we have to interact with violence, and how that might actually be a stressor for our lives. You know, like all those pieces, we have green space, right? Do we have green space that allows us to clear our minds and, you know, do physical activity? You know, so it's certainly about physical health. It's about mental health. And it's really about like how we think about investments in people and in places. And also with the comfort of saying that we're doing this on the basis of race. You know, that has been one of the things that, you know, from a policy perspective hasn't been comfortable, is to say like we are taking a race targeted approach to this issue. And that hasn't been, you know, like comfortable. And yet it's so important because otherwise we see it on the other end, right? We see it in lower life expectancy. We see it in higher chronic disease rates. We see it in a lower quality of life. So there are many ways in which, to the extent that we're not doing more of that upstream work, we end up seeing it in healthcare settings. And we also end up seeing it in loss of life earlier on, and a loss of quality of life earlier on. And in the management of disease, which ultimately makes it difficult for people to live their kind of most fruitful lives. And that's ultimately what we want to see.
Thank you. And I think there's only one question we didn't cover, but I'll have Grace glance it over too. But we had just touched on it too. How can the psychological stress of the structural racism contribute to health disparities?
I mean, it's just, you know, it's heavy. Many people that I know, and myself included, you know, as the George Floyd protests were happening and unfolding, had to reckon with the realities of what it means to be othered and what it means, you know, to just live in a world and in a country that doesn't fully value us as people of color on the basis of that alone. You know, it's like we have so much to offer, but we could only be seen in these really like kind of dimensional, very singularly dimensional prisms or lenses, and that is, you know, it's offensive and it's hurtful and it's hard. And it's saddening and it's maddening. And it's like one of those things that you feel like, why, right? There are so many questions to consider there. And so it weighs heavy on the head and it weighs heavy on the heart. And it's something that, you know, it's hard to explain. But what I'm hopeful about is that this is weighing heavy on the hearts and minds of people that aren't people of color. Right? That white people also are like in a moment of reckoning with the realities of racism and just how difficult and unjust and ridiculous it is. And, you know, that's in some ways what brings me a level of hope for the future, is that it's young people, that it's an integrated protest, that this is not just about people of color asking for more, it's all of us asking for more. And asking for something different. And, you know, that I think is important. And to the extent that our mental health is also rooted in feeling like we have options and there is hope and there's space for believing in something more, then to me, I think that, you know, this is really, it's beneficial. It's like, you know, going through a therapeutic process. You have to get the nasty, dirty stuff out in order to actually heal and get to that place. And so I'm hopeful about that, actually, that this is something that can start to free up the mental stressors that are associated with racism in this country, that we start to name it and, you know, help people to feel like there's nothing wrong with them. The system is wrong. We have to actually fix the system. There's nothing wrong with kind of the individuals that are impacted by these really problematic systems and institutions.
Thank you. And Grace,
I'm sorry, what?
Did I miss any questions?
Oh, I don't think so. No, I think we got them all.
So I just wanted to, one of the reasons why I'm joining and have accommodated this particular panel is not because I'm from Arizona, but it's because I'm working with the Maricopa County Department of Health. And one of the issues that hasn't come up here, but I would like to spend a little bit of time talking about, is the issue of home and what it means to live in Arizona, and the fact that it's summertime in Arizona, and that means it's deadly. And it's deadly primarily for people of color. It's mostly deadly for African Americans in Maricopa County and elsewhere because of heat-related deaths and dying at home. And that is also rooted in people not having access to air conditioning, as in like the unit itself or a working unit, and not being able to pay their utility bills. And that's what I call energy insecurity. So I've been working on developing an index, an energy insecurity index with our partners in the Maricopa County Department of Health to better understand the inability to meet energy needs, to be able to afford their utility bills, to be able to keep a cool home, to be able to invite people over because they feel like, you have a comfortable enough home to do that. That's a big part of the social fabric, right? The social infrastructure that I was mentioning before. So ultimately, I'd like to engage with more folks in Arizona to, kind of raise awareness about the importance of this issue, but also that COVID has made home so much more important, right? Like, we spend hours on end at home now, like, unlike before, right? There's really, fewer options in terms of being outside of the home. And so as we have this opportunity to think about where we are at home, it's also important to think about the operational aspects of it. And energy is a really important one, and it determines health in really significant ways, from all of the impacts around heat-related stress to mortality, but also to those kind of psychological impacts when people, like, the bills are weighing folks down because they can't pay it. And around the country, the folks that are most impacted by energy insecurity happen to be people of color, African American households, Latinx households, and lower income groups. So if you think about, again, like the cumulative risk, it's not just COVID, it's also all of the things that are going on at home as people are losing their jobs, have less income, less reliable income. These are all the kind of manifestations of a pandemic that came on, in a very surprising fashion, but that also has that kind of opportunity to illuminate, issues like energy insecurity, which is part of what I was kind of compelling me to participate today.
And thank you for bringing that up about concurrent disasters too. I know we normally can just have cooling stations, and I shouldn't say just. I would imagine it's still a terrible experience to need a cooling station, but now having to do a cooling station while you're worrying about the risk of COVID has just made the situation a lot more difficult. So I do appreciate that. We are lucky. I thought you probably know more than me, that our electricity companies, APS and SRP, do have a habit of suspending their cutoffs for late bills during the summer months. But I'm sure that's taken a lot of advocacy to do.
Well, it doesn't end there, right? Because it's not like a loan it's not forgiving the bills. It's just kind of like the moratoriums that we have that are COVID related, right? It doesn't necessarily mean that, folks are not at risk of foreclosure or eviction, for instance. When those moratoriums end, they're still responsible for the costs and they're certainly still at risk. And the same thing is true for utilities, that even when the seasonal moratoriums are over, it's just an accumulation of bills. And when people are managing with very little, and don't really have a lot of options for getting more, then, that's part of what makes it, risky and challenging. Maybe not in the immediate, time frame, but certainly eventually.
Yes, and even without the summer months, individuals with disabilities often use power equipment, the power chairs, or even for myself, I have a nerve stimulator implant, so I depend on electricity. And so if that was to go out, suddenly our quality of life and things that we are forcefully just used to for independence would go away.
Yeah.
So yeah, it's really important work.
Yeah, and we don't have really like the technology. We also don't have the kind of safety net benefits that allow for people to have reliable access to affordable energy, right? Like resilient power would be about having solar plus battery. In a place like, Arizona, that should be like without question. And yet, we don't really, it hasn't been an integrated technology. And certainly the people that are kind of last to adopt those new energy technologies happen to also be the ones that are most impacted by energy insecurity. And so, it's an ironic twist, but, as I am able to, reach audiences, part of what I like to do is just to introduce this concept and to help people to kind of appreciate the importance of it and the importance of having more data and providing more platforms for advocacy around this particular issue, right? And this is, like you stated, very much, an issue to be appreciated by those with disabilities, because their lives are literally, and their comfort and their health are literally dependent on access to household energy and electricity in particular. And it's not just about cooling. I mean, that's one option, that's one aspect of it, but it's certainly, kind of medical devices, electronics, refrigeration, lighting, like all of these really basic things. And what hurts my heart, and I have to say that I've done some work in Arizona, but what really hurts my heart is that when people are unable to pay their bills, there's a weight. I mean, the first speaker talked about shame. And it's actually, like the single mother that, has to tell her child that they don't have lights and the kid can't watch television because they're actively living through a cutoff. Or the older woman who's a widow who is managing and trying, everything that she can to make ends meet. But this is like the last of the priorities in terms of what she can afford to focus on. And these are the kinds of, or the veteran who spent years in the Middle East and, came back to, attempting to get the to get this American dream going by owning a home, but realizing that, housing costs also incorporate utilities and in this case, he couldn't afford it. So these are just some of the stories that I actually got when I was in Arizona and trying to, appreciate, how it is locally that folks are managing prepaid meters, and having to do that, kind of on a daily basis. And so I know it's a little off topic and it's not about race and racism, but it certainly is, something that, talk about disproportionality, right? There's a disproportionate impact of energy insecurity in communities of color, a disproportionate impact for disabled folks who may be, kind of unable to earn higher incomes because of their health status and may be reliant on Social Security benefits, for instance, and that fixed income is precisely the kind of limiting factor in terms of affordability.
Yeah, and I have been surprised to learn through this that there was statistically disproportionate, that there was more African Americans that were essential workers And so they were then using public transport, like the New York subway systems, that, you know, people of middle class privilege were just avoiding just because they had the privilege to stay at home and might not even realize that there was this disproportionate, the workforce disparity.
Yeah, no, exactly. I mean, you know, that's part of what made it so that African Americans in some ways just had many more opportunities to be exposed because they just weren't safe in their homes, you know, like that's a privilege that, you know, some folks have and some folks don't. So, and because of limited educational opportunities, because of discrimination and how it works in the labor market, right? It means that some people are only getting kind of service sector jobs, low income jobs, the types of jobs that are more front facing and people facing, you know, rather than kind of technologically enabled.
And it seems like it's another one of those exposure things too, you know. I just speaking for myself, I grew up in Scottsdale, Arizona, and so, you know, I don't know exactly where the red lines were, but there must have been some, because I did not grow up with many people of African American descent at all. And it is shocking when you just don't have any exposure to another culture. You don't know anything, and you feel honestly really ignorant when you go off to school or college and get to meet other people of different cultures. And you know, same with disability.
Sorry.
No,
Yeah.
please.
No, I was just saying that as a person of color, the same thing happened to me. You know, like I happen to be like an intelligent person, so I was able to go to like a, you know, relatively fancy school. But it was really my first opportunity and my first exposure to an all-white institution, or a primarily white institution. And that was unsettling as well. You know, so it kind of goes both ways. And it just felt like, you know, it's culture shock, you know, it's just a difficult world. So, you know, we get through it and, you know, try to manage, but, you know, this is also kind of accounts for why some people, even when given those opportunities, like it's just more challenging because these institutions weren't really made for people that, you know, just are and of a certain kilt.
And so, you know, from that, thank you so much for participating, because this is kind of how we get our message out there, right? And it's because of great experts like you and our first panelist, Jordann, that speak with us today. So thank you so much, Diane, and I really appreciate it.
Much. All right, take good care.
Thank you.
Bye-bye.
Bye. And just to finish up today, I did want to share a story that I had read. You know, it was just in the news, and I have it pulled up so I could get the details right. You know, and I just wanted to share this because I felt like it talks to the intersectionality issues that this summit series is about. And this article is so tragic. So the title is "Black Disabled Man Dies from COVID-19 After Texas Hospital Refuses to Treat Him." And so the title's a little off of the story, but to explain, an individual named Michael Hickson, who's was married and had 5 children, was hospitalized for COVID-19 on June 2nd. And then they believe that he was released from the hospital, but put into hospice care, even though he was not needing hospice care. He was stable, he was breathing on his own. It appears like he was transferred to hospice care because of his disability. He was a quadriplegic, he had a brain injury, so he underwent normal care every day without COVID-19. And it appears what happened is that this was misunderstood, and he received kind of hospice care. And during this, they stopped giving him fluids and nutrition, and he did die. And this is without his family even knowing about it. And so, you know, it's good to know about these kind of situations, as terrible as they are, because, you know, it goes to that awareness. Someone made a decision somewhere along the line that this person needed that level of care that they didn't require, and that's probably just exposure rather than any kind of malice. They probably just had never seen someone with those needs and didn't know that that person, you know, had a supporting, loving family and was still able to be a part of it. And so, when you read an article like that too, you wonder, did this happen to him because he's disabled, or did it happen because he was disabled and a person of color? Would that same situation have happened to a white individual? And that, it goes to that intersectionality that we just can't really pull apart our identities and just be one or the other. All of them are going to be together. And when we think about our policies just coming up and before our event in September, which will be our follow-up for these seminars, I just want to be thinking about how we can put these lessons learned, no matter how tragic, into policy to prevent them from happening in the future. And so thank you so much for being here, and thank you, Grace, for moderating with me. You've been wonderful. And thank you to our attendees, and you have a great July 4th.